Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and we're so excited that you've decided to join us today. This is where you get to interact with Loma University Health's experts and ask them questions on their particular topic. I will be your host today, and we have a great topic for you. So, today we're going to be talking about resilience. Now, if you are watching us live in 2022, you know that there has been a global pandemic. We have changed our lives in such a huge way, which has affected pretty much every part of our life, whether it's family, whether it's how we hold our household and do our work and interact with our friends. Everything has actually gone through quite a bit over the last 3 years. And the question is, do we have resilience to push through issues like this? How do we bounce back? How do we get more resilience if we feel like we don't have any? So we have a great speaker for us today. And we are happy to introduce you to Dr. Kelly Freeman. She is actually a professor of social work and social ecology here at Loma University Health's School of Behavioral Health, and she's been with the organization for 22 years. So I am excited to introduce you to her and also excited to what she has to share with us. So without further ado, I'd like to introduce you to Dr. Kelly Freeman.
Hi, everyone. Thank you so much for that introduction and for having me here today. I am very excited about this topic. I love talking about resiliency. It's something that I do as part of my work with Loma Linda and as part of my membership on the Loma Linda University Behavioral Health Trauma Team. So there are a few things that I hope you get out of this presentation today. One is this understanding of the definition and importance of resiliency, and then understanding the theoretical basis of the community resiliency model, which I will refer to as CRIM for the rest of this presentation. I'd also like you to be able to identify 3 ways to increase your own resiliency by using the CRIM skills that I'm going to talk about today. And hopefully, if there's time, we can engage in one short group activity together to demonstrate the skills. So let's go ahead and get started. I like to start with this definition of resiliency. And I'm just going to read it. It says, resiliency is an individual's and community's ability to identify and use individual and collective strengths in the life fully and live fully with compassion and in the present moment, and to thrive while managing the activities of daily living. I love this definition of resiliency because it speaks to that ability of the individual and the community to thrive and overcome in the face of trauma and stress. When I was in school, resiliency was viewed much like a trait that you were either lucky enough to be born with or unlucky enough to be born without. We now know that this is not the case. We know that we can foster resiliency in individuals and we can build up their resiliency to face those trauma or stress experiences that they have faced. And this is an important component of providing hope that things can change and people can overcome. So I'd like to start out by talking a little bit about some of the influences of the CRIM model, which there are many theoretical influences that went into developing this model. But one of the major ones was the ACEs study. And this has to do, the ACEs stands for, if you're not familiar with it, Adverse Childhood Experiences. And what they did with this study is they looked at, surveyed many thousands of adults, and they had them report the number of adverse experiences that they had in childhood. And these adverse experiences included things like abuse, neglect, household dysfunction, and there was a score of 10 that they could get, a total score of 10. And then they correlated that with health outcomes in adults. And what they found was very surprising, that people who had 4 or more ACEs or adverse experiences had increased rates of heart disease, chronic pulmonary lung disease, diabetes. They had mental health issues such as depression, anxiety, huge increase in suicidality and PTSD symptoms. And people who had 6 or more ACEs tended to die 20 years younger as compared to individuals who had an ACEs score of 0. So what does this all mean for us in the realm of CRIM is that we know that these physiological responses to stress and trauma begin very early in childhood, and that they have a huge impact on our physical as well as our mental health. And so if we don't do something to combat these or something to change that trajectory, we will have these negative health outcomes later on in adulthood. So that begs the question, is there something that we can do to reverse the impact of ACEs? And that was the major question that CRIM wanted to address. And then also, a lot of these public health problems that we see in our environment today, our efforts are seen through this lens as efforts to cope with these adverse childhood experiences. So can we provide people with better coping skills to deal with the stress and trauma that they've experienced? So that's what CRIM set out to do. And I'm going to talk a little bit about that because that is a hopeful model. If we can change the impact of ACEs, then adversity does not need to be our destiny. We can do things to help ourselves be more well and increase our resiliency over time. And that is what CRIM does. And so that brings me to the community resiliency model. I did want to mention that this was developed by Elaine Miller Karras. She is the developer and founder of the Trauma Resource Institute. And it's not a therapeutic model, it is a wellness model. So these are skills that you can use for yourself. You can also teach them to others, and they can be tremendously effective in your day-to-day life. And I know they've been effective in my own life and the lives of people that around the globe that we've taught them to. So let me talk just a minute about the biological or the foundations of CRIM. So CRIM is focused on biology of the human nervous system. So there are common human reactions to stressful traumatic events. No matter where we go in the world, we all have a nervous system. And we have found in interviewing multiple cultures that stress reaction that affects the mind, the body, and the spirit is the same no matter where we go, which makes CRIM very adaptable for all ages and for all different types of culture. And CRIM also helps individuals learn to read their own nervous system and return to a sense of well-being and to stay in that place of well-being. And the more we can stay in that place of well-being, the healthier we can be and the more resilient we can be. And the last thing I want to say just about the introductory to this model is that it takes away the stigma. It views trauma reactions as our body's natural response to these events. It's not about mental weakness. It's about our biology and about the way that our body responds to trauma. So it takes away that stigma that's often associated with mental health issues. Now, I'm not going to go too deep into the nervous system, but I did want to present this slide because I think it's so important to understanding our reactions to stress and trauma. The autonomic nervous system has two components. It has the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system prepares us for action. It signals the organs in our body that this is a time of stress and we need to do something very quickly in order to survive. So it increases our heart rate, increases our blood pressure, and prepares us for action. And then when the stressor or the trauma goes away, our body returns back to that well-being state where our breathing and our heart rate becomes more regulated. And this is the body's normal way of dealing with trauma. But what happens for individuals that experience too much trauma or experience too much stress over a long period of time, that sympathetic nervous system is activated even when the trauma is not present, even when it's not there. So the person or the individual stays in this heightened place that is discomfort and is associated with the nervous system not being regulated and those effects that can impact our well-being over time. So what CRIM is trying to do is to help us regulate the nervous system so the individual's not experiencing those stress reactions and not experiencing that wear and tear on the body, but helps us be more regulated in our day-to-day actions. And then this slide right here really quickly talks about the ability of the brain to change and adjust. So people who have experienced trauma reactions or who have experienced anxiety, they know that it is with you a lot of the time. It is ever present. So there's not a lot of rest from those reactions. But we can teach the body to attune to different types of reactions within the body. So neuroplasticity speaks to the lifelong capacity of the brain to change and rewire itself in response to stimulation of learning and experience. So we don't have to attune to those trauma reactions. We can teach our brain to attune to those sensations of well-being and those sensations of resilience. And the more that we do that, the more that we strengthen those brain cells that fire and wire together. So these skills are not something that you can just do once and your stress goes away. It takes practice because you are actually resculpting the brain, the neural networks inside the brain to do something different and to have a different reaction. This led the famous that medical professional to say that therapists and self-help is Daniel Siegel who said this. Therapists and self-help skills that you do, you're actually a neurosculptor. You're resculpting the brain to deal with these kind of reactions in a new and different way. So finally, for this part, I want to say when we learn to discern the differences between sensations of distress and sensations of well-being, which is where I'm going to be taking you with these CRIM skills, we have a choice of what we can attend to. Do we want to foster and grow and strengthen those pathways that view sensations through these traumatic ways, or do we want to change and choose to pay attention to the sensations of wellness and well-being within our body? So once we're able to know those differences, we can choose to attend to these sensations of well-being, which is going to have the impact of strengthening our resiliency over time. So let me pause there and see if there are any questions from the audience.
Well, thank you, Kelly. This has been a really great introduction, and we have questions coming through. But one of the things that I loved what you said is about choice. A lot of times when we think of stress or anxiety, we think of something happening to us and there's nothing we can do about it. I love the empowerment piece of what you talked about. So with this, we have a question that is coming through about basically, is this you talked about therapy. So is this something that you do with your therapist, or is this something I can do without a health professional to help my resiliency?
Yeah, that's a great question. So there are therapists that integrate the CRIM model within the work that they do. We do have a resiliency clinic as part of the School of Behavioral Health, and some of those therapists incorporate CRIM, but it is a wellness set of skills. So you do not need to be a therapist in order to implement these. These are self-help skills that you can use for yourself right now in this space to help you experience that sense of wellness. And in the second half, I'm going to talk very specifically about the skills and how you can use them for yourself.
Perfect. Well, maybe this is a good time to maybe stop here for a second and say, if maybe one of our audience members is saying, this is amazing, I need to be more resilient, I need to get this into my life, where do they go to have more information?
So there's a couple of places. You can, if you are outside of Loma Linda, you can contact the Trauma Resource Institute. It's online. I can provide that email site for you or that website for you after the presentation, and if we can post that somewhere. And then also you can contact the Resiliency Clinic within the School of Behavioral Health, and that is someplace that you can get more information if you're within the Loma Linda system.
Okay, great. So another thing here, another question that we have is, what key skills make you resilient?
Yes. So it's really about paying attention to your well-being. And I'm going to get into the skills in the second piece of this. There are actually 6 skills that you can do to kind of foster your own resiliency and build that over time. I'm going to talk about 3 of those today because of the short time. And so we'll get into that into the next section.
Okay, so let me get to one more question here from our audience. And don't forget, if you're watching us live, you can absolutely ask questions of Dr. Freeman. So the question here is this model appropriate for children? And then the question says, if so, how can I help my child develop more resiliency?
Yeah. Absolutely. These skills are very adaptive to children. That's actually my area, is working with very young children. I have a 2-year-old grandbaby, and she already knows these skills. I already work with her on them. It's very cute to see them implement them. But, my thinking is, if we can help children regulate their nervous system from a very early age and teach these skills to them, they're going to be better off in trying to not have these reactions to trauma and stress over, and especially with COVID right now. There, a lot of these kids were brought up within the era of COVID. So teaching these skills to them at an early age can help foster that wellness with them over the long period of time. And we do adapt them, instead of using more verbal explanation, we use more modeling, we use more art and drawing in teaching the children the skills. So maybe that's something we can talk about at a future date, is how to adapt these skills to work with children.
Okay, great. Well, thank you, Dr. Freeman. Why don't we get to the second half of your presentation?
Okay, great. Okay, so as I was just mentioning, the community resiliency model, or CRIM, is a set of 6 wellness skills. I'm going to talk about 3 of those today. I'm going to talk about the tracking, the grounding, and resourcing. I will touch a little bit on shift and stay throughout my conversation. So the basic premise of CRIM says that we each have a resilient zone. Some people have a narrower resilient zone, some have a wider resilient zone, but this has to do with the amount of stress that an individual can tolerate at any given time and still be in what's called their wellness zone. So you can see in this diagram, there are ups and downs. You see the little slope that goes up and down. This indicates that when you are in your resilient zone, you can still experience a full range of emotion. You can still experience sadness, being happy, being angry or frustrated, but you're still able to tolerate it. You're still able to problem solve and be your best self. And this has to do with our brain functioning. One of the demonstrations that I often give is I use my hand to demonstrate the brain. And this is like our cortex. Our cortex is the part of the brain that is associated with those higher order organizational thoughts that help us be rational, help us problem solve. It's when we're thinking through things and being our best self. But when that sympathetic nervous system kicks in, like I talked about before, or it gets overloaded or reactive, even when trauma is not present, our cortex actually goes offline, that thinking part of our brain, and we become reactive. The reactive part of our brain takes part. And I don't know if you've ever had that experience where you've said or done something that you later regret, and you're like, why did I say that? Why was I yelling at my spouse or, a friend? It's because we're in that survival mode. Our reactionary brain is taking over. And so what CREM is trying to do through the skills is bring that cortex back online so that we can effectively problem solve and be our best self and not have all that arousal that comes with those sensations associated with stress and trauma. So like I said, resiliency zone doesn't mean that you're just always happy. It means you're in your place of well-being, the best place. And that's what we're trying to get people back to. But what often happens is we have some kind of stressor in our life, and it doesn't even have to be a stressor. It can be a reminder of the stressor. And a lot of times these reminders are at a subconscious level. We're not even aware of when they occur, but these stressors come along and we get stuck in this high zone, or we get stuck in this low zone where we have these sensations in our body that aren't comfortable, like being edgy or irritable or having a great deal of anxiety or panic or angry outbursts when we're stuck on high, or we have the depression or the isolation or the exhaustion that comes with being stuck on low. And so the skills that I'm going to teach you right now help us get back to that resilient zone, back to that place of well-being. And they also have the added benefit of not only helping us get back to that regulated well-being place faster, but they also widen our resilience zone so we can tolerate more the more we practice the skills and move on. So let's talk about the first skill. The first skill is tracking. And for me, this is one of the most important skills in the CREM model because it is the part that saves it to your nervous system. So tracking has to do with noticing or paying attention to what's happening inside your body at the present moment. So we can determine at any moment if a sensation is pleasant, unpleasant, or neutral. And I've taught this all over the world, and tracking is very easy, generally very easy for people if you ask them, to talk about sensations of distress. People will say, oh, my muscles are tight, or my stomach hurts, or, I feel nervous. But when you ask them to talk about sensations that are pleasant or neutral, they kind of look at you like, what? I'm not really sure about that because we're not used to attending to or paying attention to sensations that are pleasant or neutral. And so I'm going to teach you about that within the context of resourcing in the next skill. But I wanted to give you an example of this, of how my daughter uses this in her role as a nurse, because I think it kind of brings the point of tracking to life. So she's a nurse, and she would often go in and assess her patients and their pain level. That's one of the things that nurses do. The patient calls you in, they say, I'm in pain. And they say, where's your pain? And maybe they say, it's in my chest. And what is your level of pain on a scale of 1 to 10? And they'll say, well, it's a 10. I need help now. I need pain medicine. And she'd say, okay, let me go see what I can do and see if I can get you some pain medicine. I'll be back in about 10 or 15 minutes. She'd no longer get to the door and they're calling her back. I need it now. I need something now. Because what she's done is actually draw attention to that pain, right? And even intensified that pain by asking what it's rated. So she needs this information. So I invited her to try one of the CREM skills and to ask the individual at the end of her pain assessment, is there a place in your body that you feel less pain or feels more pleasant or neutral? And the patient would kind of look at her questioningly and say, well, okay, my feet are not as in pain as my chest. And she said, well, I'd like to invite you to draw your attention to your feet and notice what happens. Just draw attention to your feet for one moment. And so the patient does this, says, okay, I feel a little bit better. Okay, so I'm going to go get your pain medicine, but what I want you to do is pay attention to those sensations in your feet that are more pleasant until I get back. And she would notice that she could go do what she needed to do. And the person was able to tolerate that pain better because she drew their attention to a place of well-being in their body. So that's a mini example of what tracking can do and helping you identify those sensations that are more pleasant or neutral in your nervous system. So that's what we want to teach the brain to do, because that's a piece of developing that resiliency. So let's go to, so there's different ways to read sensations. You can observe them in your body. Like if you notice you're holding your hands tight, or your shoulders, or, when you get stressed, your shoulders tend to go higher and higher. You could assess your internal climate. Are you feeling tense muscles? Is your breathing faster? Are you warm or hot? I notice, I get a little nervous when I present, so I can feel my body getting hotter. And so I can actually track that and use one of my skills. I'll use grounding, which I'm going to teach you in a few minutes. And the minute I notice that my feet are touching the ground, I feel my body get a little cooler. I'm regulating that sympathetic nervous system that's getting activated. And because I've practiced it so much, it's almost like an immediate response. And then you can also self-report or ask people what they're sensing inside. So that's about tracking. So the next skill, and tracking is used with all the other skills. Like I said, it's the save button on the nervous system. So resourcing has to do with a person, place, or thing, or memory, or part of yourself that makes you feel calm, pleasant, peaceful, strong, or resilient. It can be something real or imagined, and it can be internal, like a characteristic, like this is not true about me, but maybe you're a really funny person, or you're a really kind person, or it could be external, like a family member, or, something that brings you joy. So normally at this point, I'd ask the audience to share their own personal resource, but I'm going to just share mine just to give you an example. My favorite resource is my 2-year-old granddaughter. Her name is Taylor. And you probably noticed I'm smiling right now. I can't even think about her without smiling. She's 2 and she's starting to talk, and she calls me Amma because she couldn't say grandma when she started talking. So she calls me Amma. And, just when she says like, I love you, Amma. And I can, smell her, she has that baby smell that's so wonderful. I can feel the weight of her body as, I hold her and hear her little voice and see her eyes shining. And all of that, it almost brings happy tears to my eyes when I think about it. And I feel this great warmth in my body, just kind of spreading out. And it's almost like a warm, but also a little tingling that's very pleasant in my body. And I already feel myself, even in talking to you, kind of calming down, just thinking of that resource. And so it's bringing me deeper into my resilient zone. So what I did just there was share my resource, but I also tracked, right? I talked about the sensations that I was experiencing inside my body that were pleasant. And I'm just going to take a moment and sit with those sensations, because that's going to hit that save button on my nervous system. So when I have a moment when I'm getting distressed, or even in this moment when I'm a little nervous, it's going to regulate my nervous system and help me be in that place of well-being where I can think about what I'm saying, what I'm talking, and what I need to do, and not experience those negative trauma reactions that occur. So this is a great place to be. I also did trauma resource intensification. I also did resource intensification by talking about extra things that can bring this resource to life. So thinking about how my grandbaby smells and the weight of her body. These are extra things. The more I can bring that resource to life in my mind's eye, the more powerful it's going to be, and the more powerful the effect is going to be on my well-being. So I want to intensify those resources as much as possible. So because certain skills work better at different times, we always teach more than one skill. So resourcing is something that you can do. Another skill that you can do is grounding. Grounding is one of my skills I use all the time. And grounding has to do with having a direct contact of your body or a part of your body with something that provides support in the present moment. So putting your hand on the table, even pushing your hands together, or feeling your feet on the ground. So I'd just like to invite you in this moment to just take a second and notice how your feet are touching the ground. Notice how your body is being held up by the chair that you're sitting on. Notice how the back of the chair is supporting your back. And then as you do these things, just scan your body and notice any places in your body that feel pleasant or neutral. And if you notice any places of discomfort, just shift your attention to a place in the body that is more pleasant and neutral, and just stay with that for a moment. And then notice what happens on the inside. Did your muscles become more relaxed or not? Did you take a deep breath? Did you feel a change in your body temperature? That is grounding, and that can bring a sense of well-being as well. Again, this is something that I use in my everyday life. If I have something that I have to do that I'm nervous about, I'll just take a moment and feel my feet on the ground. I used to have to ground about 10 or 15 minutes before I would feel a really good effect in my body that would be lasting. Now I can just think about my feet on the ground and my body reacts because I've established those neural connections in my body. And so my body processes it really quickly and I have the reaction. That's the benefit of practice. I do want to point out that you can ground in many different positions. Many of the people that we have worked with have felt it to be very beneficial to ground, like as you're going to bed, if you have trouble sleeping or you're experiencing a lot of anxiety as you're trying to go to bed, do the grounding exercise. Feel your body, the point of contact between your body and the bed. Pay attention to how your head is resting on the pillow, and then scan your body and notice those places of sensation and well-being. And that locks that into the nervous system, that tracking locks it in. And then that will help. Oftentimes I'm asleep before I even get through the whole exercise. So you can ground laying down. You can also do it while walking, noticing your feet touching the ground as you're taking steps. If you're going to an important meeting where you really need to be in your zone of well-being, take a few minutes to ground yourself. And like I said, the more you practice these things, the more they're going to impact your well-being, and the more that's going to increase your zone of resilience over time. So that's what I have for you today. I hope that you find these skills beneficial, and that you can use them in your own life. They've been tremendously helpful for myself. There's a lot of growing research to suggest that these are effective skills for people, and they do increase our well-being over time. So thank you so much for this opportunity to share the community resiliency model, and I'm open to any questions.
Well, Dr. Freeman, thank you so much. I feel like these are life-changing skills that you just talked to us about today, and I think it's a message to everyone. We do have some questions coming in. One of them is, what are key points to keep in mind during a crisis to maintain resilience? And I'm going to piggyback off of that. When you are in the crisis or you're feeling terrible, sometimes it is hard to get out of yourself, to kind of think logically, to go through this process. What is something that we can do to keep remembering that we actually have control and we need to kind of go through the steps?
Yeah. So I think, your body is set up for survival. So during the midst of a crisis, you're going to be doing what you need to be doing during that crisis. Your body's going to be reacting in a way that is going to help you best survive that. So I'm hesitant to interrupt that process, but as the crisis starts to ease, you can start using these skills in that moment. You can start just like grounding yourself, noticing your feet on the ground. You can get a drink of water. Even a drink of water is one of what we call our help now skills that can help bring the nervous system back online, and there's a reason why one of the first things we do with people that are having crises is offer them water, because it has that effect on the nervous system. One of the best ones that I have seen for kind of helping in the moment is pressing on a wall. It sounds strange, but it really regulates the nervous system and brings you back to that place where you can start thinking about the things that you need to do in this moment to keep you and whoever's involved with this crisis in place. If it's a situation where you're experiencing pain, you can try and focus on a part of your body that is not part of that pain system, so that it can be tolerated. We've used this to help people that are undergoing at the dentist that are fearful of pain and things like that. So you can use them in that moment to help. So as soon as you're able to, you can start using the skills. We do have an iChill app. It's called iChill. And it's free. You can download it. It's for Apple phones and other types of iPhones or other types of phones, not iPhones, but other types of phones. And so you can download that app and it has all the skills on there. And the Help Now skills are ones that can be really helpful in the midst of a trauma too, because they're going to be like, I don't have time to do resourcing and grounding. I need help now. And so that's what all of those skills are, like drinking water, putting your hands on a hard surface, pressing on the wall, looking around the room and counting, noticing colors or counting. All of those things can be helpful in that moment as you're trying to get through that trauma.
Okay. So we have another question, Dr. Freeman, and it is, how has the COVID-19 pandemic impacted resiliency in people?
Yeah, I think the research is still out on that. I can tell you my experiences is I do believe that people have narrower resilience zones. It doesn't take much to stress people out these days. And so I think using some kind of coping skills, and I think the CREM skills are great to help widen that resilience zone so we can get back to that place where we were pre-COVID, can be tremendously helpful.
Great. Well, thank you so much, Dr. Freeman, for being here with us today and sharing this important information. Just one last note, because I want everyone to know that there is an app that they can download, and like Dr. Freeman mentioned, with iPhone and Android. So could you spell that for us on what they should look on in their app store?
Yes, and let me see if I can actually show it here really quick. Um, it's iChill, ICHILL, and it looks like the app looks like, I don't know if you can see. Oh, I guess
Probably
it won't
not.
let me see it because of my screen blurring. But what it has is a bunch of individuals like spread out this way and sitting on a globe. So that should be helpful because there's a few things called iChill, but that is the one that is related to the CREM model.
And importantly, it's free. Am I correct in saying that?
It's absolutely free and it's in Spanish and English.
Perfect. Well, thank you again, Dr. Freeman, for this important information. And I want to thank our audience as well for joining us. Now, I want to invite you to our next Wellness Live. It is going to be in November, but a little bit earlier because of the Thanksgiving holiday. So we have Dr. Scott Lee coming to talk to us about diabetes and a whole person care approach. Now, if you are a person who knows anybody that has diabetes or you have diabetes, you will not want to miss that on November 10th. Well, again, I want to thank you for joining us and wish you all a great